introduce myself. My name is Burtch. I'm a veterinary internal medicine specialist. I've been practicing on the Central Coast for 25 years. So today, my focus is going to be pet intestinal health, and you'll probably see that we have Dr. Terry Arteaga, who's a cancer specialist and brilliant individual. She's is going to be speaking in July, and then Dr. Elizabeth Curto, who's an ophthalmologist, will be speaking in September. So this is actually the same dog. This is a dog that won the #1 contest for weight loss in the UK that was sponsored by a dog food company that said, pet obesity is truly a problem. And so this is a 9-month difference for this dog. And I think that's an important thing for all of us to pay attention to as we care for our pets and think about their intestinal health, is that sometimes their big brown eyes tell us that they need another snack, and that's not always the case. They might need a walk instead. So the focus here is to talk about normal intestinal function and things that can go wrong in dogs and cats. So quick overview of the anatomy of the intestines. So basically chewing and swallowing and the esophagus, which is a tube that without us having to think about it, all our food goes into our stomach through our esophagus. People, we have in our vertical stature, always have gravity helping us. So when we swallow, gravity is going to help bring that food from our mouth to our stomach. In dogs and cats, when you think about it as a quadruped, there's not gravity helping them. And so esophageal disease is actually, we won't cover it a lot, but it is something that you really need to pay attention to, because you can damage the esophagus, and if that is damaged, then movement of food from the mouth to the stomach becomes a problem. The stomach is mostly a storage unit. It basically holds food, lets it kind of start getting slimy and movable before it moves into the small intestines, which is the biggest, the most important part as far as nutrition absorption. So the small intestines do most of the absorbing of nutrition, and we'll talk about that when we get to that. And then the large intestines is just another, it's like the storage unit at the other end. It's basically holding stool and getting it ready for passing out. And it does help. There are some electrolytes, and water is absorbed there as well. And I put the liver and pancreas on there. They're not part of the tube of the intestines, but the liver is very important in that the blood from the intestinal tract, called the portal circulation, all goes to the liver. And the reason that's important is you can get bacteria from your intestines going to your liver, and that's sometimes liver disease and intestinal disease can be pretty well linked, because you can actually have inflammation in your intestines affect your liver. And then the pancreas, which makes digestive enzymes, and we'll talk about that a little bit more when we get to the small intestines. And so, more detail about the stomach. So we chew the food. Chewing the food is very important. I'm actually babysitting my granddog this weekend. My older son has my first granddog. And his food bowl is actually a puzzle. And it's just looks like a maze, because he eats too fast. And you guys have probably seen those bowls that have a bunch of things sticking up, because dogs will just, swallow, kibble whole. And that chewing is a big part of trying to make sure that food gets into a digestible state. Swallowing, we talked about the esophagus, and storing it. So you eat your meal, the stomach is a storage unit. It also has contractility, so it helps mix things a little bit. And chyme is the word that we use for what comes out of the stomach and get ready to go in the small intestine. So by the time it's leaving the stomach, it looks like pudding. And it should be in that kind of mixed up, kind of almost barely solid state. And that's important because the small intestines is a pretty narrow tube. And any of you who have had a dog that has gotten a foreign body, or my favorite is the 22-pound cat with a pistachio nut stuck in his intestines that we had to take to surgery. I mean, you can get things that are big enough that if they make it through this opening can cause problems. The next slide I put up because I found this on the internet, and it really bothered me, because it says, how to cure a dog's stomach ache. And it basically shows you rolling your dog in a 360. Has anyone here heard of the term bloat? Okay, so this term bloat, or it's when the stomach bloats up and like a balloon. The medical term is gastric dilatation and volvulus. That means the stomach gets big and it spins on an axis. And when we think of about the stomach and how you've got a tube coming into it and a tube coming out of it, if you twist that stomach, it's like those candy wrappers. Those two tubes seal off. And that stomach can fill up with food and air. And it's a common problem in big dogs with a deep chest. And if they eat and exercise close together, a lot of times they'll swallow air. That stomach will distend and twist, and it becomes a medical emergency because all these vessels lose their supply when you twist those two ends. So this is not how to cure a stomach ache in your dog. And I was surprised to see this, and I thought I'd add it because it is true that you can help your pet with gas. So just like babies that go through colic, and towards the end of the intestines, and we'll talk about this with the large intestine, you can do some massage in your dog's stomach to help move gas and things through. So I would much rather you put your hands on your dog and try to, or your pet, and say a dog or a cat too, and help them relieve the discomfort than rolling them like this. So moving past the stomach, and again, here's our stomach and small intestines. So the goal for the small intestines is basically the pancreas, which is makes all our digestive enzyme, has a little, say it's this, it's a little tube that goes right into the water through a papilla and dumps those digestive enzymes in. So that chyme, that pudding, is moving out of the stomach, and all these digestive enzymes get added. They break down fat, they break down starch a little bit, and then they also break down proteins. And so what are these big chunks of food start to become microscopic structures that can be absorbed through the intestines. So in the intestines, and I'll show some pictures later, the villi of the intestines. So when you look at this and you go, oh, there's a lot of intestines. How long is the intestines of a dog? So apparently, it's about 2.5 times the body length. So your little 2-foot dog is going to have 5 feet of small intestines. So it's a lot of surface area. It's a big tube, but on top of that, there's ways that it increases its surface area on top of being very long. So in the small intestines, the villi start absorption, fat is digested, and bile, which everybody knows about because it's that kind of yellow-colored vomit that some of the dogs will bring up. That is also a digestive assistant, and it digests mostly fat. It gets stored in the gallbladder, which is, it's made in the liver, stored in the gallbladder. Whenever we eat a meal, our gallbladder actually does this little contraction, squirts bile into our small intestines, right around the area where the pancreatic enzymes comes in, and it starts emulsifying fat. And so fat, which can be these big long chains, suddenly gets broken up so that the intestines can absorb it. And movement of the intestines. So movement to move digestive, movement's a big, motility is a big part of what I actually think is a big part of intestinal disease. So that's there's a lot of that later in the talk. Then we get to the large intestines, which basically is a storage unit for the waste products, the stuff that didn't get absorbed. And the main job of the large intestines is absorbing water. There's a lot of fermenting bacteria. Like when you think about horses, any of the ruminants and horses have a lot of fermentation issues in their large intestine. But this bacteria plays a big role in helping keep our intestines healthy. And when we talk about bacterial balance, we'll talk about that a little bit. So nutrients and ions can be absorbed here. And so when we talk about the large intestines, there's the ascending, the transverse, and the descending colon. So when I was talking a little bit about using massage, basically you can follow that ascending on the right across your pet's abdomen and descending on the left, and try to push gas through when you have a dog that's uncomfortable, just like a baby with colic. You know, that people put the kid's knees up towards their stomach, pull it down, and you can actually try to massage in that direction. Now, if your dog's or your cat's really uncomfortable, they're going to be like, no way, get away from me. But it is something you can do to help move gas in your pet at home. So, what can go wrong in this dog chose to do a selfie at a time that I might not have chosen to do a selfie, but let's talk a little bit about what can go wrong. So when we get into the microscopic anatomy of the small intestines and large intestines, so if you think about that tube, on that surface area, there's these villi here, and what they're doing is they're significantly increasing the surface area that nutrition can be absorbed through. And there's actually microvilli, so then this happens again. on top of each one of these fingers. So you can see the large intestine has a lot shorter structures there. They don't have as much responsibility for absorbing this nutrition. There's actually a lymph vessel in each one of these little villi that helps take that fat and protein and it moves it down basically to vessels down here that start to put it back into the circulation and give it to the liver. Okay? And this would be kind of a cartoon of what healthy intestines look like microscopically. So healthy intestines. The important thing for healthy intestines is good motility, and that is that the intestines move regularly. And in the small intestines, not having movement has a lot of consequences because what you can do is have a change in what bacteria is where in the intestines. And bacteria can play a big role in causing more problems. And so a balanced microbiome, which is our fancy name for gut bacteria, and that's certainly getting a lot of press these days because in people they're finding that it plays a big role in obesity, and even they're starting to look at mental health being affected by having altered gut biome in people. When I went to my 25th reunion for vet school, our keynote speaker was a PhD that talked about that gut biome, and she had one of her students do a research paper where she actually took genetically obese rats. So there's a line of rats that are always obese genetically, and then normal weight rats. And what she did is she wiped out the intestinal flora from both of them and switched them. And over a 3 to 6 month period, the skinny rats got fat and the fat rats got skinny. And so she was actually able to document that the biome in the GI tract actually played a role. And when we think about people that get the gastric bypass surgery, probably part of what we're doing is altering their biome a little bit and helping them lose weight by changing their gut, and their intestinal gut health. Microscopic health. So that is, now we get into the kind of nerdy medicine stuff. There's something called the gut-associated lymphatic tissue. So there's actually like a mini immune system of its own in the intestines. So when we think about our general immune system, there's actually an entire immune system in our gut association that helps us with things like, am I allergic to peanuts? Do I have shellfish allergies? Those are all things where the intestines were triggered to overreact at some point in a child's youth or in a situation where that lymphatic system was overreacted and is going to maintain that overreaction, that alarmist response to that certain protein in certain food. So in the intestines, you can get infectious. So viral infection is certainly one of the main things we see in the small intestines. And this little picture talks a little bit about the different types of viruses we can see. Coronavirus, usually a self-limiting diarrhea-causing virus. Rotavirus, similarly, we don't worry too much about that. Parvovirus, which attacks down deep in the crypts here, can wipe these villi out. And actually, pets with parvo can actually have, it's almost like somebody came and chopped all these villi off. And those dogs get really sick for that reason and need a lot of supportive care with usually IV fluids and in some cases protein IV to regain that health of those intestines. Parasites, so most of you guys know about all these roundworms, whipworms, hookworms are the things that we, the puppies that get their worming. In cats, definitely same thing. There's mobilization of a lot of these worms in a mother kitty or a mother dog, and they're transmammary, and you can actually get them through the mammary glands and milk because they get mobilized during pregnancy. And so that's part of why we think of parasites as having to do with kittens and puppies, is because they actually are often exposed to it during that, either in utero or in nursing. And then tapeworms. Our tapeworms in dogs and cats is most commonly transmitted through fleas. So actually the flea is an intermediary host, and dogs, so tapeworms look like little pieces of rice. If anyone's ever seen that, like, oh, there's rice grains kind of on the dog's bed. It's actually a worm that looks like tape, and the way it reproduces is it lets go of a called gravid proglottis. It's like an egg sac, and it comes out and it looks like a piece of rice. When it first comes out, it'll move a little bit if you see it, but then when it dries, it becomes this rice grain looking thing. And if you see that, on your dog's bed or around your cat's bum, then that means that they've got a tapeworm infection. Hunting cats definitely get that as well.
So Giardia wouldn't have the same effect that like parvo would, that wipes stuff out in there?
Yes, Giardia is a protozoal infection, and so it will definitely cause damage. Sometimes it's more in the large intestines, and so it'll cause damage that'll cause leakiness of the villi and extra fluid, and you get more of a bloody diarrhea in Giardia a lot of times.
But once it's cured, it's fine after that? I mean, it's not it destroys the villi and do they grow back, or I mean?
Yes, they grow back.
Okay.
Yeah, that's a very good point. Thanks. Our intestinal lining replaces itself about every 7 to 10 days. So when you think about it, it's pretty phenomenal that we can do that.
Wow.
And I think that, and those of you who have either experienced chemotherapy or know someone who has experienced chemotherapy, that's part of why chemotherapy is so damaging to people, is that because it hits the rapidly dividing cells. Cancer is rapidly dividing, so when we give chemotherapy, we're trying to stop those cells from being able to reproduce themselves. Well, we hit some other populations of rapidly dividing cells, which is the lining of the intestines and the white blood cells. And that's part of why people who are undergoing chemotherapy, or dogs, have to get a white cell count, and we watch them for diarrhea and other GI side effects, because what we're doing is saying, hey, rapidly dividing cells, we're not going to let you divide, we're going to interrupt your whole cell cycle, and sometimes we'll hit the good guy cells in that process. We're working on that with targeted therapy, and I think that's going to be one of the really exciting things about Dr. Arteaga's talk, because the advances in cancer medicine are phenomenal. So other things that can go wrong, bacteria. And so you can get a protozoal or a bacterial infection, and certainly those can wipe out the villi, damage the intestines. Salmonella, Campylobacter, E. coli is well known to be a source of that for certain breeds. There's actually a syndrome called boxer colitis that boxers were prone to, this thing where they get this horrible diarrhea and kind of waste away. We equated it to Crohn's disease originally in people, and we're suppressing their immune system and saying, this is inflammatory cells that are really getting out of hand in the colon. And a brilliant researcher at Cornell figured out that it's a pathogenic E. coli, and it's an E. coli that would cause that architectural damage to the colon. And we treat those dogs with a 6-week course of antibiotics now that solves the problem. So we're always learning too. I think about in my early career, it was like we would immunosuppress those dogs, and now knowing that it was a bacterial infection the whole time, it's kind of that. There's always room for learning. And then foreign material is the other thing that can happen in the intestines. This is actually an X-ray of a cat. This is barium, so it's a white material that shows up because it's got metal in it. It shows up bright on an X-ray. So to orient you, this is the spine here. This is the diaphragm on this kitty. Heart's up here, head's up here, and this is the stomach. So there's contrast in the stomach. Liver is here. These are the little kidneys right here. And this kidney has eaten a string. And so what's happened is it's a linear foreign body. It's a string that's gone into the intestines, and the intestines are trying to move that string, but the string is probably hung up in the stomach and the pylorus. And so the intestines work to move it, and they end up bunching up almost, like what you would think about with an accordion, because it's trying to move that string, and it can't move it. And so this is a classic X-ray of a cat with a linear foreign body, and that kitty has to go to surgery. And what we try to do is make as few intestinal incisions as possible to pull the string out. Like if you go to the middle and you pull it out. And one of the first things you learn in emergency medicine is a kitty that's vomiting, you look under the tongue. Because cats will often play with string or something like that, and it'll get caught under their tongue. And so you can flip up the tongue and see a string across there. And I've had a kitty that's going all the way through. And you have to figure out how far it's gone, because if it's just gone to the stomach, then I can get it with my scope, and then I don't have to go be cut open. But if it's gone this far, then you do have to go in there and make sure also that string doesn't, like when you look at this little U-bend here, if that string's trying to stay straight, it starts to cut the intestines and you start to get damage, like a sawing action. And so waiting too long can be deadly for these patients with what we call linear foreign bodies. Dogs usually it's like eating a towel, and I worry a little bit about those. I had somebody come to me and say, my vet told, no, it wasn't the vet, she looked on the internet, she was trying to entertain her young husky, which in and of itself is a task. And someone had suggested that she take those braided rope bones and soak them in chicken broth to make them more flavorful for her dog. And dog ate it, and dog had intestines that looked like this, and it ended up unfortunately being a surgical emergency. So you just have to watch those internet tips. You know, don't roll a beagle and don't soak the rope toys in chicken broth. So how do we prevent these infectious things? Here's 2 methods.
I need to teach you how to do that.
I hire that dog for my backyard to do. So first of all, good hygiene is always going to make a difference when you talk about infectious disease for dogs and cats. And so the other, I kind of covered infectious quickly. Certain questions are welcome, but what's the other thing that can happen to the intestines? And we'll go a little bit into those 3 things: that motility, intestinal balance, and basically the health of the tissue itself that let a dog stay comfortable and not run into problems. So inflammatory bowel disease, which is this kind of big umbrella term for a whole bunch of different types of inflammation that can happen in the intestines, is one of the things that we see that can cause problems in dogs and cats. So it's basically damage to the intestines, and I think the 3 things that contribute to this, some of you that know me have heard me talk about what I call the triangle of intestinal health. And when you think about the triangle, it's the motility, the ability of the intestines to move, the health of the tissue that's lining the intestines, the cellular health, and the bacterial balance. And when I have a patient that's ill, I try to figure out which corner started it. Did it start with bacterial overgrowth, and then we got inflammation, and then now we have motility changes? Did this dog have a motility problem, and now the bacteria bloomed, and there's inflammation? So that's part of the detective work that goes into figuring things out. Sometimes it's the course of events, sometimes it's the clinical signs that help us figure that out. So that's my triangle there. Change in the ability of the intestines to move, changing the bacteria of the small intestines, and inflammation in the intestinal wall. And that can really make animals feel yucky. And so when you look, this is a pretty normal intestines. This is what happens when there's inflammation. They start to wipe out those villi and start to invade them as well. And so when these pets have inflammatory bowel disease, this is how they feel. And most of the time they're just like, ugh. And a lot of these pets will be like, they go up to their bowl and they kind of look at it and go, I'm hungry, I don't want to eat. I think that when I eat, I'll get in trouble, or I'll feel yucky afterwards. Or last time I ate this food, I threw it up. And that's a lot of my patients end up not ever going back to the food that they were eating before they got sick, because they end up with some type of visceral memory of discomfort. So, no pun intended. So motility, basically, quickly, there's 2 types of small intestinal motility: peristalsis, and that's basically when you take a bite and you swallow, you don't have to think about that food again until you flush. The bolus of food, open up and contract behind it, and it just propels it down towards the other end. There's also what's called segmental mixing, and that's just these little spasming things that help make that chyme a little softer. And so it's just kind of like if you think about squeezing a balloon back and forth. So this is the type that I think more often causes problems. So healthy muscle in the intestines moves the peristalsis. So inflammation can be deep enough to the muscle layer where those muscles are like, I kind of forgot what I'm supposed to do. I don't want to move anymore. And so the food will sit there, and then sometimes the bacteria will be like, whoa, look at all this food. I'm going to just grow and like suddenly make 5 million copies of myself. And it might not be the right type of bacteria for that area in the intestines. And the texture or the bulk of the food really affects the motility. I'm a big fan of fiber in my patients' diets. I think it makes a big difference. And so the fiber content will often make a big difference in that peristalsis. When there's more bulk to that food, the gut's like, oh, here it comes. I gotta contract and try to move it along. So that's motility. And then there's the gut biome. I couldn't find a good picture of gut biome, but basically in a normal distribution of bacteria, these are the parts of the small intestine: duodenum, jejunum, ileum. They taught us to remember Dow Jones Industrial in med school to know the orders of the small intestine come. And then this is the beginning of the large intestine. So starch will get digested and is helped by the bacteria as you get towards the ileum. And you finish digesting those starches so that they don't go into the colon and feed the bad guy bacteria and let it thrive and multiply and potentially start to move up into the small intestines. And so when you get small intestinal bacterial overgrowth, and you'll hear all kinds of names: dysbiosis, SIBOG, there's all kinds of biome irregularities. These all just mean that the intestinal flora is gone wrong, had a bad month. So what happens? We get normal bacteria change in the small intestines. Vitamin B12 or cobalamin often will go down. It's an essential co-transport. It helps transport nutrition in the small intestines. Dogs and cats that have a significant problem in their small intestines with absorption will have whole body depletion of this vitamin. Gas production and discomfort. So some of my patients will come in and say, in the middle of the night, the dog goes, yike, and just runs through the house, or the cat starts yowling, and it's gas bubbles a lot of times that will create discomfort in those pets. And so what you see, you'll see weight loss and other intestinal signs. Some dogs, it's just, I had one golden retriever from down here that he adopted through golden retriever rescue, perfect dog, everything about him, but she couldn't put weight on him. And she was feeding him 2 to 3 times the calories he needed to gain weight. And his cobalamin was immeasurable. I couldn't measure it. And for the rest of his life, he had to be on supplementation of vitamin B12. And he was fine until he got sick with something else, but we were able to fix it just with B12. So another picture of inflammatory bowel disease. So inflammation, or the health of the intestines. So this is normal intestines here, and then this is what happens when you get inflammation. So this is all touching food. These are all normal cells that kind of help this food move down to a tract of blood and lymph that then lets it go to the liver and become packageable units of nutrition. And so bacteria can change the inflammation. The type of food is definitely, and who out here has a dog or a cat with allergies to a certain type of food? Yeah. So you can, you figure out, oh, it's chicken, or you figure out it's some other protein source. And protein sources tend to be the most common reason for food responsive disease. Antibiotic responsive, that Boxer colitis we just talked about, is a type of inflammatory bowel disease that antibiotics will fix. And then a motility disorder. A lot of dogs with motility disorder, or a dog or a cat, may do a lot better with a little more bulk in their foods. But bulk also, fiber also helps with your bacterial balance. It's actually, a lot of times the byproducts of fiber is what helps the intestinal tract get better. And then cancer, unfortunately, has to go on the list. Inflammatory bowel disease is a microscopic diagnosis. So many people will say, oh, my dog has inflammatory bowel disease. And it may. And if you change their diet and they got better, then yes, that very well could be inflammatory bowel disease. But to truly call it that, we have to get a biopsy of the intestines. And trust me, I'm not a big fan of get in there and biopsy. And certainly 20 years ago, I treated these diseases way differently than I do now. And my training was get a biopsy, put them on steroids. Now the first thing I'll do is say, let's talk about the diet. Let's change the diet. What are they eating? Let's try a novel protein. Let's try some fiber. And it's lovely because probably close to 30% of my patients don't ever need an endoscopy because we're able to kind of park the car into a garage of perfect diet and perfect nutrition that lets them be healthy without needing to go through those.
What type of fiber do you recommend?
Most often I'll use psyllium as a fiber source. There's a, do you know about Stewart's fiber treats? There's a
No.
company called Stewart's that makes a kitty cat treat they use mostly ground peanut hulls, so it's a peanut hull fiber source, but because it's a fish flavored treat, that's how I can get fiber in cats. Because cats, if you put psyllium on cat's food, they usually are like cats. But if you have a cat that will take pills well, you can use small capsules of psyllium. So, and because it's a nice combination of soluble and insoluble fiber, that's my reasoning for that. And it's actually the most successful food for one of the diseases we're going to talk about real quick is high fiber. It's something called colon in cat. And psyllium is really the magic ingredient in that diet that helps those cats. So just quickly, have you guys heard of celiac disease in people? Okay, also called non-tropical sprue. It's basically gluten intolerance. And so I thought this was a good picture for, this is normal intestines. This is what happens when you have some ingredient in your diet that your body can't handle. And so people who get celiac disease, actually what will happen is the leakiness of their gut will get so bad that their body proteins will drop. And there's not enough protein in their blood, and fluid will push through their blood vessels, and they'll get big swollen legs and get to a point where they basically have water in spaces between their cells because they don't have enough protein to keep fluid in their vessels. So we do that. We get protein losing enteropathy is the name of that subcategory of inflammatory bowel disease. So protein loss, dietary. A lot of the dogs that I see with a low protein in their blood that have intestinal stones, one of the first things we'll do is put them on a novel protein like rabbit or something their dog hasn't seen before. And about 30% of them will get better. We won't have to move any further. Some of them have inflammatory bowel disease, and we'll get those biopsies via endoscopy and document that and treat it. Unfortunately, cancer and lymphoma is probably the most common thing we see in the guts. Cats get something called small cell lymphoma, which can be a very treatable disease. And then there's a syndrome called primary lymphangiectasia, and that's basically where this lymph vessel right here dilates, blows up, and just won't work again. And that's a bad disease. I don't like it because I really struggle to treat it. And let me go down and show you lymphangiectasia here. So this is a picture of what I see when I scope an animal. This is the small intestines. And it's not normal to have all these little white kind of pimply things here. Some of that's inflammation, but some of that is protein that's just kind of oozing into the surface of the intestines. And here's these villi we talked about. You can see how dilated this is. This is all fat and protein that's just kind of stagnating in that spot because that normal flow is broken. So this can be from inflammation, and sometimes we can reverse it, but it's one of my least favorite diseases because it's really challenging to treat. So here's some pictures of intestines that are pretty normal. This is inflammatory bowel disease. You can see this wall is pretty thin, and then gets pretty thick. And what this is inflammatory cells, lymphocytes, plasmacytes, other types of white blood cells that have gone in there because they think there's a problem and created an anatomical change, and therefore inability to absorb nutrition. And that's not very much space for nutrition to go through versus this. And then unfortunately cancer can look even worse. You can see how thick that can get. So what are the signs of intestinal disease? I didn't partially do beagles, but apparently they're in a lot of the pictures. Jamie, hopefully you can appreciate that. And I like that it's the magazine of Beagle Welfare Scheme. So signs of disease in the intestines: not eating, diarrhea, vomiting, weight loss, and excess gas and discomfort. I just recently diagnosed a dog with inflammatory bowel disease that the regular vet called me probably 9 months ago, and he says, "Oh, Marianne, and I don't know really what's going on, but every once in a while this dog will just kind of cramp and feel kind of yucky, and the owner is really tuned into this dog." And I said, "Well, Jeff, if anything, it's going to be inflammatory bowel disease or bacterial overgrowth." So it took about 3 months before the signs were enough for the dog to come and see me. And sure enough, we measured the B12 and it was super low. So that tells me that there's bacterial overgrowth because the bacteria in the small intestine want that B12 and will use it for itself and then depletes the whole body of it. And we put him on B12 and he gained a couple pounds and he got a little better and his episodes got farther apart. But eventually we ultrasounded him and actually could see anatomical changes in his intestines, and right now we're on a month trial of an antibiotic called metronidazole that has an anti-inflammatory effect to see if he does okay before we jump to scoping. But all he had was this, like once every 4 to 6 weeks, he would just kind of cramp up and, cry and, kind of go into this praying position or curl up around his belly. And I think that this is an evolution towards something that I'm hoping we can stop. I'm going way over, so I'll speed up here. So just a couple of diseases that can happen. This is megacolon, and you can see this is, this is a kitty, spine, diaphragm, so heart and head are up here. So this is the abdomen. This is colon. This is all poop. And cats get something called megacolon where the muscle around their colon stops working. And it just, in spite of their stuff there to push out, but that muscle's like, sorry, I'm not gonna play today. I'm not gonna do that. And 10 years ago, we would go and remove the colon in these cats and just attach the small intestines to the rectum and say, it's not working, let's try to fix it. More often now we're using fiber, and there's a diet called fiber-responsive oil plant Canaan makes that's full of psyllium that is probably one of the most successful diets out there to fix the problem. Knowing about it and using laxatives as well is big, and what you feed your cat, big part of how to avoid that. Bacterial overgrowth, this is the the second boring slide, basically talking about what bacterial overgrowth does. So you get inflammatory, cytokines are like the chemical messengers, and you change things here, and you end up getting fat that will get absorbed, and then this whole cycle, of course, because once you get motility disorder, that bacteria is like, I'm not getting pushed through, I'm gonna hang out here. Let's make another 5 million puppies today, and that's what happens in the small intestine. So weight loss, diarrhea and gas, you get vitamin D levels that change. There's another vitamin D called folate that we can measure to help determine if there's bacterial overgrowth. Your digestion's affected. You can treat it with fiber and diet change and probiotics. So probiotics are an interesting thing because there's a neurologist out there trying to get us to stop using them. And I think the big thing is it's all about numbers. So I went to an advanced specialist gastroenterology meeting about 1.5 years ago, and they said, oh, you should all use BL3, and it's this online super expensive bacteria or probiotic for people. But I think it's really just the number of colony forming units. So there's something called CFUs, and if you buy a box of Fortiflora, which is Purina's product, they say, oh, that whole box is going to have a smaller number of bacteria than, say, Synacor. They're all out there competing for this kind of thing. But look at the colony forming units, and it's not necessarily dog and cat bacteria, because we don't really know that their biome is that different from ours. And so I'll often tell my clients you can use a human probiotic as well. Actually, there was just some papers coming out that people and dogs are pretty close in their biome. And so back to the kind of what's the reason for intestinal disease. It's really interactions between diet, inflammation, motility, your bacterial balance, and infection. So Cody's telling me my time's up. So gut microbes, your genetic susceptibility, environmental triggers like diet, and your immune response, and there's the inflammatory bowel disease. So all of these can play a role, and through diet and changing stress too, but also changing fiber content, etc. We can try to keep our cats and dogs and healthy. Questions?